It is now 11:03, so I think we're going to start getting going as a couple more folks trickle in. So welcome to Ducks in a Row, Advanced Directives for Healthcare. I'm Beverly and I'm with People's Memorial Association, and we've teamed up with the Seattle Public Library to bring this webinar to y'all. We'll be recording today, so if there's anything important that pops up that you worried you missed, don't worry, you'll be able to review it a little bit later and we'll send you a link. So we have with us today Nancy Sloat from the Seattle Public Libraries. Nancy, do you want to say a little something?
Good morning, everyone. My name is Nancy Sloat, and I am the Older Adults Program Manager for the Seattle Public Library. I definitely wanted to welcome you to the second program in our Ducks in a Row series. We are absolutely delighted to be partnering with People's Memorial Association to offer you this program series about end-of-life planning and considerations. I just wanted to do a quick update on those of you who are have books to pick up at the Seattle Public Library holds. You're probably aware that our curbside pickup has been suspended for today and tomorrow because of the air quality. So please go ahead and just check the Seattle Public Library website for updates, or you can call our quick information. I'll put that information into the chat box. Don't worry about the books that you might have on hold. We will be extending those. We totally understand the circumstances of what's been happening with our air quality. And then just very quickly, I wanted to invite you all to look at other programs that the Seattle Public Library has been offering on our older adults calendar. I will put that URL into the chat box as well. We have a civic coffee hour coming up on Thursday with Sam Zimbabwe. He's the director of the Seattle Department of Transportation. It's your time to ask him questions. And next Tuesday, of course, we have the third part of this series on funeral arrangements. And with that, I just wanted to turn this back over to Beverly. Thank you.
Wonderful. Thank you so much, Nancy. All right. Oh, well, like I said, this is People's Memorial Association. We do have a couple of housekeeping items we'll just knock out of the way right before we get started. Please make sure that you're all on mute. Makes it a little bit easier if we can't hear everybody doing the dishes and the dogs barking. Like I said, we will be recording today's presentation. We'll make it available on our website and make sure you also have a direct link. You will find a chat box to go ahead and submit any questions you might have, as well as a Q&A feature. If you're maybe a little bit shy and you don't want anybody to see what your question is, feel free to use that Q&A. It'll only be visible to us panelists, or you can actually go ahead and toggle your settings on there when you are in the chat box to send something directly to either myself or to Amanda, Nancy, or Bonnie, and then we're happy to go ahead and keep your identity hidden. And we're going to have a whole Q&A at the end. It looks like today we've got just about 50 participants, so we're expecting some pretty good questions today. So make sure that you share things as they occur to you, but we know that Bonnie is going to just about cover everything you could possibly be curious about. Ooh, we've already got something in the chat. Oh, wonderful. So just a quick little tidbit about People's Memorial. We are the oldest and largest memorial society in the U.S. We were founded in 1939 right here in Seattle, and we just had a big to-do this past year to celebrate our 80th anniversary. We are the only nonprofit in Washington providing funeral education and consumer advocacy. We are, however, an affiliate of the National Funeral Consumers Alliance. There's about 73 similar organizations, I believe, just scattered around the country. So if you're joining us from a little bit further away, People's Memorial is specific to serving Washingtonians, but it's distinctly possible that there is another organization a little bit closer to your home that can help support you in a pretty similar way to what we do. So in case you were curious, in our 80-year tenure, we've got about 214,000 people, I believe, that have joined. And of those, about 70,000 of them are actually still living. So pretty robust membership body. Keeps us hopping here in the office. And in terms of what we actually do, education's kind of the big thing. If you're joining us here, this is a good example of how we have to sort of tailor the offerings and the format a little bit to meet folks' needs. We've shifted to an all online modality, and it's been quite a learning experience. So this is just an example of one of the free classes we offer, and we've got tons of other resources available up on our website. Advocacy is another big part of what we do. We do state level legislative lobbying, and if you are seeing some stuff in the news about aquamation or recompose, also called human composting, we worked really hard to help get that legislation passed to offer more funeral options to Washington families. So that keeps us pretty busy as well, but it's a big passion of ours, is making sure that families have the access to the types of arrangements that meet their spiritual and social needs and are actually affordable. Increasing price transparency is something that we're very committed to. We spend a lot of time making sure that families have access to price information that can be a little challenging to come across. We're getting ready to publish our biannual price survey, so keep your eyes peeled for that. And like I said, we are really invested in making sure that the total diversity of families that we serve here in Washington and that are served by other organizations also have access to the things that meet their needs. And that access to affordable cremation and burial, there's a whole lot of stuff on our website about that, and I won't bore you too much, but we're really keen on making sure that families are able to access what they need and not break the bank and go into debt just trying to do right by a loved one. And so this is part of an example of our Ducks in the Row series, where we talk to you all about planning for end of life. So thank you, welcome, and I'm about to go ahead and turn it over to Bonnie Bizzell, one of our community partners. She's from Honoring Choices Pacific Northwest. Their website is honoringchoicespnw.org if you want to go and take a peek at some of the little tidbits they're working on. I know they're pretty busy. So I'm going to go ahead and hand this off to Bonnie. Thank you so much for being here, Bonnie.
Great. Thank you so much. Can everybody hear me okay? Yeah? Okay. Let me just get my screen up. And I'm assuming you can all see it. If not, I'm sure someone will let me know. I am so honored and thrilled to be here talking to everyone out there in this partnership that's between People's Memorial Association and the Seattle Public Library. What a great opportunity for learning and doing things that we always think about doing, but sometimes we don't have time to do, or we don't think we have time to do. Before I begin, I always like to just acknowledge that wherever we are at, we're on Indigenous land, and that we at Honoring Choices Pacific Northwest want to thank those who protected the land for eons and centuries for their stewardship. And then I want to congratulate you. Yay! Thank you for being here. There is a lot going on right now. There are wildfires, the Black Lives Movement is still going on, COVID-19, there's a lot happening. And so for you to carve out space and time today to talk about advanced care planning and advanced directive documents is phenomenal. Advanced care planning is always important for any adult 18 and over, but especially in the time, I think, right now that we're in with COVID-19. It is one way that if we're uncertain about things, it's one way that we can actually take some of that control or feel like we have some of that control back. And that's simply because planning helps us understand what's important to us. And when we understand what's important to us, we can help others understand that, and they can, if they have to, only if they have to, make better healthcare decisions for us. Planning, advanced care planning is a lot like a birth plan. You set aside the ideas of what you want to have happen, and then you hope it happens, and sometimes it doesn't always turn out that way. You know, for example, I know a lot of people being at home at the end is really important to them, and sometimes that's just not possible. But that doesn't mean that can't inform of what we make where they're at look like. We can make, if they have to be in the hospital, we can make it look more like home. So it's always important to share that ideal state so that no matter what the situation or the conditions, people around you who care for you, who can advocate for you on your behalf, can make sure you can get what you really want. And, you know, honestly, providers really want to give you the care you want. and do what you would like to have done. So with that in mind, you're going to see me looking down quite a bit. I have notes. I always have notes, and I don't want to forget anything. And today we're just going to talk about who Honoring Choices Pacific Northwest is. I think it's really important that people know who we are so you understand where you're getting your information. We're going to talk about advanced care planning and why it's important, why we need to do it. The fact that you're here means you probably already know, but I'm just going to reaffirm that for you. And finally, we're going to look at the documents to use and talk a little bit about things to consider as you're filling them out. And as Beverly said, we're going to spend some time answering questions. I will do my best. I will be honest, sometimes I get questions that I've never gotten before, and so I have to do research. And if I have to do that, we'll make sure that you get the answers that you need. So just so you know, I have put a few items in the chat box already. I know we have some people who are just phone only, so feel free, you'll hear about where you can reach me directly. Feel free to reach out to me directly if you'd like. In the chat box, I've put a link to our website, a link to our advanced directive, which I'll be looking at a little bit, and a link to the hierarchy of Washington State that we'll also look at on the screen later on. But I'd just like to call that out. So, who is Honoring Choices Pacific Northwest? If you haven't heard from us or heard about us, I'm glad that I can introduce you to us. We are a joint initiative between the Washington State Medical Association and the Washington State Hospital Association. And the reason it's important that these two entities got together and said, let's do advanced care planning is because, quite frankly, if it's towards the end of life, you're probably going to be at the hospital at some point, and you're definitely going to have a doctor or provider there. And so the fact that these two recognize that these two organizations recognize that they want to come together to make it better for everyone is phenomenal. Our vision is that everyone will receive care that honors personal values and goals at the end of life. We're philanthropic. We're a nonprofit philanthropic, which means that everything we do is for free. So if you go on our website and you reach out to us and you need some help, we'll do it for free. And we do everything from helping individuals to actually training people how to have these conversations. So just keep that in mind, because if you or your church group, your book club or whatever wants to be able to do this, reach out to us and we'll help train you so that you can feel confident and competent in helping people discover their own values and preferences and name them in an advanced care plan, an advanced directive or whatever. And we do this really by helping the public make informed choices. And as I already said, working with organizations. I personally work with everything from hospital organizations to community collectives. And we help people learn about the different choices and make informed, shared decision-making choices so that individuals are really in control of what they want. And we help those organizations that we partner with, how do they discuss, how do they record, and if it's appropriate, how do they honor. So that's us. And one more thing that we hope that everyone, our goal for everyone is that they will talk about it, they will write it down, and they will share it around. So that means exploring different ideas, feeling comfortable doing that, putting down those values and preferences and those choices in a written document, legal, or there's some other ways that aren't legal but can help guide the care, if not direct the care, and then share it around. Tell everyone who is important to you, and sometimes people who aren't important to you. I have told my neighbor down the street because my neighbor is super nosy, and I wanted to make sure that there wouldn't be any strife or any questioning. So share it around. All right. Now I'm going to take a pause because I would love for you to take a minute to reflect on what brings you joy. What brings you joy in your day-to-day life? If you feel comfortable, I would love it for you to share it in the chat box. so that I can take a look at it. But while you're thinking about it, maybe considering sharing it, I'm going to talk about what brings me joy. And one of the most important things that brings me joy, and I'll see if you can see him, is that little critter right there. That's my dog, Finn. He's named Finn because his tail, his rear goes back and forth like the tail of a fish when he walks. And I love playing with him. And I'm not just talking about like, I just throw it and wait for him to bring it back. I like get down on all fours. I growl. I do an open growl with him. I tussle with him. I love doing that. It brings me so much joy and energy in my day-to-day life. And so I'd love to see if there are any, or if any of the panelists can let me know if there's people who have said what brings them joy. I know a lot of times people say family or gardening, cooking, even watching movies. Beverly or Amanda or Nancy, do you see anything? Okay, not hearing anything. Hi, Beverly. Is there anything in the chat box?
Yeah, it looks like we have a couple good options. We have some folks mentioning how much they love to see their friends, especially when they take a nice walk with a close friend. Lots of folks like music. Lots of hiking fans here.
Yeah, hard times for hiking fans right now, that's for sure.
You're telling me. I've had to cancel a couple trips now. Looks like we've got a lot of people that love reading, literature, journalism.
Perfect.
Yeah.
Thank you, Beverly. Thank you for helping me get a window into that. I really appreciate that. So why would I ask you what brings you joy? Well, congratulations. You've done advanced care planning. See how fun that was? See, it's not as scary as some people think it is. Advanced care planning is a process. It's a communication process. It's between individuals and healthcare agents and other people to understand, reflect on, discuss, and plan for future healthcare decisions for when a time when that individual who's talking about everything isn't able to make medical decisions for themselves. And it's only when you as an individual could not make those medical decisions. So knowing what brings you joy is actually a critical piece of that advanced care planning. And I'm going to talk you through using my example as we go forward of how that actually comes out to play in those documents. Now, as you can see on the circle on the screen, or if you're not, if you're just by phone, there's circles that go big circle and then smaller circles. Within that advanced care planning process is an advance directive, something we call an advance directive. An advance directive is any document that helps people understand those values and preferences. A lot of people talk about the durable power of attorney for healthcare. You can see that I have a little circle with the DPOH in there. That's also sometimes called your healthcare agent, or the healthcare directive. I have listed it as HCD, just a quick little thing. The healthcare directive, a lot of people call that the living will. Those are part of the advance directive. Some people aren't comfortable with those legal documents or even medical documents that you'll see on the screen. There's another circle that says POLST, P-O-L-S-T, which stands for Physician Order for Life-Sustaining Treatment. And that can help direct care as well. It's a little bit different, and I'll talk about that difference in a bit. But, you know, not everyone is comfortable with a legal document or even with a medical document. And so advance directives, that part of that planning process could actually be something as simple as a letter to your loved one about what's important to you. One of the most beautiful and poignant examples I can think of is there was a gentleman who he had done his legal documents, but he wanted to augment that and supplement that. And what he did is he wrote a letter to his children, and he listed each child by name and talked about their strengths, and then talked about what role he hoped they would play if it was his end of life. So it was really beautiful. Now, he could have done that without also doing a legal document, and that would have told those individual kids what was important to him, and what role they could play. You know, sometimes there is an example of someone who just did a good job certificate, like, you know, those things that you can prep from online and it says good job. And it said good job, and he just wrote out, when my heart has stopped beating and you let me go, you have done a good job. Thank you. And that tells you a lot about what's important to him. Now, the letter and the good job certificate are not legal documents, so they can guide the care. They can help people understand what's important. They can't direct the care. A durable power of attorney for healthcare actually can direct the care because you're naming someone to direct that care on your behalf. A healthcare directive can help direct the care because you're laying out what treatments are important to you. And I'll go into more about both of these documents, as well as the PULSE, which can also direct care, which is a medical document. So that's what advanced care planning is. It's important to remember the documents are a critical piece, but they're not the only piece to advanced care planning. So, why is it important that you're here? Why is it important that we need to plan? Well, it's important to the individuals within the community. And when we ask people about end-of-life issues or planning, we get the statistics that you're seeing on the screen. So, for example, there is this disconnect between the desire of wanting to talk about it, 90% want to do that, and only 27% have. There is, if the conversation is difficult, then getting it down can be even harder. 82% say it's really important to put their wishes in writings, and 23%, just over 1 in 5 have actually done that. And then we see that not putting it down in writing and not having these conversations, what happens is we get a chasm between what people actually want at the end of life and what happens. 70% of people prefer to die in their home, and only 70, and yet 70% die in a long-term facility or hospital. Now, like I said earlier, it's not always a guarantee that you're going to get, but if I know that someone who prefers to die at home is in a long-term care facility, I'm going to do whatever I can to make sure that it feels as homey as possible. Bring that favorite blanket and pillow, you know, maybe bring some photographs. Now, if it's hard on the people who are in this situation, it is the aftershocks of death create a need for those who are left behind. So without planning, you are getting over 8 times more likelihood of prolonged grief and 5 times more likelihood of PTSD. That's huge for the people that you care most about. So it's not only a gift to you, it's a gift for everyone around you who means a lot to you. But it can also help you right now. Yeah, it's not just about the end of life. It's not just about the finality. Planning can actually help you right now. Why and how? Well, in truth, advanced care planning is about how you want to live, not how you want to die. And I hope that I can shift you to think that way. Planning means that you've identified values and preferences. Planning means that you know what's important to you, and as you go through, you can name that. So, for example, I'm going to give you 2 stories about how it can help you with, you know, creating a stronger bond with your provider, helping you become more health literate, helping you feel empowered or feel activated to be able to ask for what you need. I've got 2 stories on that. So the first one I will tell you is a famous person story because people love famous people story. And then the second one is just a me story. It's just about me, so it's not famous, but it might be relatable, especially since a lot of people like to hike. So Dr. Jennifer Brokaw is the daughter of Tom Brokaw, famous newsman, or Darth Vader, that guy. I know I'm not an impersonation impressionist or whatever it's called. And she spoke to a conference that we held several years ago, and she talked about trying to get her dad to talk about end-of-life planning. And, you know, there is even this famous TED Talk. I'll make sure Amanda has a link to that. So with the follow-up, they can send that to you in case you're interested. It's just 15 minutes. And Tom Brokaw is like, I've told you all, you know what I want. And Dr. Jennifer Brokaw, who ER doctor who started a practice around end-of-life care for folks, said, I don't know what you're talking about, Dad. Called out her newsman father on the spot. I don't know really what's important to you. I don't know what your values or preferences are. You may have written it down, but I've never seen the document, which is what typically happens. And so they went back after that TED Talk and they sat down and they had a real conversation. And the whole family and Tom Brokaw filled out a new document. And then I think it was about 5 years ago he was diagnosed with cancer. And Jennifer Brokaw said one of the first things we did was pull out that old advanced care planning document, that advanced directive, and we went through it. And we first made sure that the values and preferences he talked about still were the values and preferences we had that day. And then once we recognized and acknowledged that and confirmed that, then when we went in for treatment, that helped us guide what kind of cancer treatment he got. And I can attest from my mother, who had a second round of non-Hodgkin's lymphoma last summer. We went in and we knew that the most important thing to her was drinking a daily glass of pink champagne. Well, it wasn't possible. That part of the plan wasn't possible when she was getting treated, but we knew we wanted to get her back as soon as possible to be able to drink pink champagne every day because it brings her joy. Just that one glass. And so that's one way it can help you now when there's a major diagnosis. I'm going to talk about a more minor thing with my example. I, like many of you out there, love to hike. I love going in the woods. I feel so refreshed and just sort of reinvigorated when I'm able to be out hiking. I'm not a master hiker. I tend to stay at really low slopes, but I still really enjoy it. I also have horrible allergies, and the biggest contribution to my allergies is actually trees, which is not particularly great in the Pacific Northwest. But I still love doing it, and I still get out there, and I just make it part of my life. It's part of my life. So when my allergist comes to me and he says, we have a new drug that I think is really going to help control your symptoms, I know that being able to hike and going out is important to me. So if he's talking about this new drug and he says, you're going to be more sun sensitive, I can say, well, I love being out hiking. How does that impact me being able to be out of doors for 4 to 5 hours? Well, if you're sun sensitive, you're going to want to curtail that. I may not want that drug because it may impede on my quality of life on what I find important. Or say he said, we have this new drug that's really going to help. It's going to make you more lethargic. You're going to feel a little bit more tired all the time. Again, I might say, you know, I really like being out and outdoors and being active. That's not going to work for me. So that's another way that planning can actually help you in the here and now. Right. So I'm going to switch over, but before I switch to talking about the documents, are there any questions in the chat box or the Q&A that I should know about and answer right now? I'm asking Beverly, thank you.
Well, it looks like we don't have too many questions just yet, but we do have someone who is curious if a video interview can serve as a legal advance directive in the state of Washington.
You know, a lot of things are in flux right now. I would be very cautious. I'm happy to talk to our legal. The reason I would be cautious is because right now, my understanding of what's in the RCWs in Washington State is it's all about the written document. So, and I know that that doesn't actually lend itself to a lot of people. But what I will do is I promise that I will go back and ask that specific question. I said I would get questions that I've never gotten before. So I will go back and get that answer and make sure that in whatever follow-up that if there's a definitive that it's stated. But I would highly recommend to do both. I would actually say if you're doing a video and you're comfortable also doing the written document, then I would go ahead and do that. But I think a video is a great way to really show people what's important to you. Sometimes just writing it out isn't, there's something about, like if you saw how I played with my dog, you would have a really good idea of what that looks like. And so if I said to you, it's important that I be able to play with my dog in the same way, and that may not be what I want. I may say it's important that I have meaningful interactions with him, and that would look different, perhaps. But if I showed you what was meaningful to me, how powerful is that? And what a great way to communicate to everyone, especially if you're nervous about how they might react to a conversation. So thank you for that question. I appreciate it.
You ready for another?
I am. Bring it.
How about if someone's planning to move out of state? Is there a federal version?
So here's the thing about advance directives. Every state has their own version. It is not done at the federal level at all. So here's what I suggest. There is a wonderful option called Prepare for Your Care. It's online, it's free, it's offered in English and Spanish, and it'll ask you what state you're in, and then it'll help you, it actually has video guides to help you go through the entire document to fill it out. So that's one option for you, because that way you'll get the state that you're going to, you can fill it out that way. Another thing is that if it's gonna be a while before you move, and there's a Washington document that you really love. I really like ours. I think it's really great, but I'm biased. That you could start by working on that, and then whenever you go to the other state, you can look for their state document, and you will have a lot of the work done for you. A lot of times, the law, like even between Washington and Oregon, the laws are different. For example, it seems minor, but they don't call it a healthcare agent. It's a healthcare representative, and it's actually legally written that way. So it's important to understand. And if you're moving somewhere and you want a resource in that state, reach out to me. If I have a resource to send you to, I will totally do that. There are honoring choices around the country. Some are Minneapolis, Minnesota, Florida, Texas. We're Pacific Northwest because we try to capture a lot more of it. So hopefully that helps.
Okay, wonderful. Well, do these papers have to be completed with a lawyer?
No, they don't. I'm so excited you asked me that. You can do this on your own. You can do this on your own. And I'm going to talk about what the different documents do and what the requirements are to get them complete. And if you need help, come to us. We're free. We're free. We'll help you figure that out too. So you do not need a lawyer to do these specific ones. That's the durable power of attorney for healthcare, not the durable power for attorney. That's something different, but it has to have healthcare and the healthcare directive. But the PULSE does require medical personnel, and I'll talk about that in a bit.
Okay. Well,
These are great questions.
I know, right? Okay.
Yeah.
So one more. Where do you keep all these documents once you're done with them?
Oh, it's like I planted people in the audience. You guys are fantastic.
This is looking a little suspicious.
I did not plan anyone, I promise you. So where do you keep these documents? That's a great question. You want to, first of all, share the documents if you have the documents. Make photocopies, give them to people, especially your healthcare agents that if you name one. Because you want them to have a copy of it. You want to share it with, if there's a hospital you normally go to, share it with them. Your primary care physician or provider, share it with them. You at home want to keep it in a place that's easily accessible. So not a safe that only you have the combination to, not a safety deposit box. You want to put it in a place, and then you want to say, hey, this is where you can find all my documents. One of my former stepmothers actually has a binder with all of her documents in it on her bookshelf right in front of the door. So if you walk into her house, it says important documents. You know, it's nothing that's gonna those documents aren't the documents that, you know, have all the bank accounts and stuff in them, but they're important documents that if someone needs to make decisions on her behalf, or someone needs to do things like funeral planning, that it's right there and people can get it right away. So make sure people know where you're putting them. That doesn't mean you can't keep them in the cloud. You can, but just be mindful. There isn't a national. Well, there are places where you can do paid registry. I know that there's an end of life. It recently came out, end of life page, collective page, that the folks at Death Over Dinner did, which is fantastic. So there are places that you can look at and find other places to serve besides just physically in your home too.
Yeah, that's wonderful.
Any other questions?
I think that was our last one, but gosh, yeah, I think it's such a sign. I'm getting quite a bit older now, because I remember when I saw my parents' binder on the shelf, I was so stressed out about that as a kid, and now I'm like, ooh, a good binder? I love that.
It's Leslie Knope and all of us, right? From Parks and Recreation. Ooh, binder! Okay, well, I'm going to talk about the documents now and hopefully clarify what to think about and what to do. So you'll see on the screen, if you can't see on the screen, I have images of the Honoring Choices Pacific Northwest Advanced Directive, the legal advanced directive. There's a picture of our durable power of attorney for healthcare section, and then our healthcare directive section. And then there's also a picture of the physician order for life-sustaining treatment, which is in bright green. The pulse does not have to be in bright green to be legal or to be used, but it is the color that people tend to look for, certainly in Washington State and around the country. I know we had someone who's moving. They have different versions of this. Sometimes they call it a mulch, sometimes they call it something else, and different colors. So there is a national pulse network that I can also share that link to so that you guys can get it as a follow-up. So it's important to know the difference between these documents. So I'm going to group the durable power of attorney for healthcare, that healthcare agent, and the healthcare directive, that living will. I'm going to group those two together because those are for future healthcare. So it's what if. What if I'm in the hospital for a long time and I can't make decisions? What if I go into surgery and then they need to do something else and someone needs to make that decision for me and I'm under anesthesia and can't make that decision? What if? So it's all about what if. The pulse and the physician's order for life-sustaining treatment, that bright green one, is about what is. What is my current health and what do I want to have happen? And these documents can sometimes overlap, especially if there's an emergent situation. But it's important to understand that those are the primary and core essential differences between the two documents. I mean, not the two, but the pulse and the other documents. Sorry about that. So the durable power of attorney for healthcare or healthcare agent is really a great place to describe personal values and goals for treatment. So with me and my dog, I would probably write out, I really want to be able to play with my dog in a meaningful way. This doesn't mean I have to growl or get on all fours, but I would like to be able to play catch with him. I would like to be able to pat him and scratch his back. That might be one way that I express it. Or I might someday decide that, no, I really want to be on all fours. And I really, it's really important that whatever happens, that I'm able to get down and play tug of war with my dog on the ground. Those are just two different ways that it might shape out in a personal values or goals for treatment. Because then if my husband or whomever has to make decisions for me, he can say to the doctor, okay, you said this treatment, you want to do this for her. Will she be able to do X, Y, and Z? By framing your personal goals and values around your outcomes, what's important for your outcomes, by understanding that, then then it's not so much about which treatment, but really making sure, as I said, that you're getting that quality of life that you want in a way that you want it. The durable power of attorney for healthcare is also where you name the person who will speak on your behalf or make decisions on your behalf if you cannot, only if you cannot. So you can name one person. Washington State, you can name a couple of alternatives. I have done that myself because, you know, if someone is named and then they get in that situation and decide they can't, they just don't have strength to do it or what have you, then, you know, it's always good to have others. The person doesn't have to be near you, although it's nice to have someone who's local. I often suggest if you're going to have someone far away as the primary, then really try to find a local person who can be one of the alternatives so that they can at least talk to someone while they're trying to get in touch with a person who might have a different time zone or different other things that might come into play. You know, one of the questions I get is like, if I name someone my healthcare agent, are they going to be financially responsible for the decisions they make? No, they are not. They are your person. In fact, the law says that whoever the healthcare agent is making those decisions needs to speak and do this as if they were the patient themselves. I'm paraphrasing. It's a little bit more legal than that, but Washington State is very strong about that. So why is it important that you name healthcare agents? You know, well, if you don't worry, it's already done for you. And maybe that's good enough for you, but it's already decided. And that can bring up some questions. So the first thing is that if a guardian appointed by the court has been named, they're going to be the one who makes decisions, but they're still not going to know who you are, so they're still going to need to have some information. Then it's your healthcare agent. And then if you haven't named anyone, then it's your spouse or registered domestic partner. And what's important about this is that, you know, I'll be talking to people and telling them that it will automatically be their spouse or their registered domestic partner. And inevitably someone will say, oh, I've been separated for like 20 years. And I have to ask, well, are you legally divorced? Have you legally separated or severed that relationship? Because if you haven't, they're still the ones who are going to make the decision, and they're still the ones who are going to be called. So it's important to remember that. If you have adult children and you haven't named anyone, and you know they're the ones who are going to end up making the decision, in Washington State, they all have to agree. They have to agree. So if you have more than one, they have to agree on the treatment and care, and that can cause delay. It can cause disagreement. I give the example, my brother lives in Texas. I love him. We agree on a lot of things, but we don't agree on everything. And I would hate for my mom or my dad to get delayed treatment because he and I were arguing about some points that could have easily been cleared up. Same thing with parents, adult siblings. So just know if there's more than one in a group, that they're going to have to agree. So that leads me to, well, who should be a healthcare agent? So first and foremost, you want to ask people. Remember I talked about how Tom Brokaw was like, well, we've already named it, we've done it. And Jennifer Brokaw was like, I didn't know that I was named. I don't know what you're talking about. So you want to ask the person, you want to make sure they agree to do this. A lot of people get surprised at the bedside when they find out that they're going to be making these really big decisions. And you want that person to talk about your goals and values and preferences. And I want to tell you right now that this can be a very joyous, lovely experience. I talked about how my mother went through her second round of non-Hodgkin's lymphoma last summer. We spent every day going back and forth to her treatment, talking about her goals and values and preferences. And we did it by talking about our history together and what was important and what made us who we are. And through those conversations, we laughed so hard that we cried. It doesn't mean that those conversations weren't serious. It doesn't mean those conversations didn't provide me in particular really important information. It did. It did. So I just want to point out that, you know, you can talk about your history together, and that can be a way in. You want this person to follow your decisions even if they don't agree. Excuse me. So even though someone may love you and talk up to you, if they're not going to do what you ask them to do, then they're not going to be a good healthcare agent, because again, that person needs to be your advocate, your voice, your channel, your decision making. And finally, this person may have to make decisions in very difficult moments. And so you want a person who can do that. And that's not everyone. Sometimes they would do all three, but they are not the person to make decisions in a difficult moment. And that's okay. That's okay. They can help, they can support whoever you choose in those other three areas. I'm going to take a really quick drink of water. All right. All right. So the next document is the healthcare directive. Now, I don't talk about this one as much because it's a little bit more cut and dry. It really lays out when this document would take precedence, and it's in a very specific situation where you're in a terminal condition or a permanent unconscious condition, right? Because you can be in a terminal condition and still make decisions. And it's really about specific life-sustaining treatments in these specific situations, nutrition and hydration primarily. So that is what it really addresses. It's a lot more black and white and cut and dry. But I know a lot of people know about this document, and it can help quite a bit, because even if you've named a healthcare agent, they can look at this and understand what's important to you. Now, the healthcare agent and the healthcare directive can be completed by notarizing. You can have a notary do it. And now you can actually have virtual notaries right now because of COVID. Or you can have it witnessed. They do not need to be both witnessed and notarized, or you can have them witnessed. It is important to know that the durable power of attorney for healthcare directive, the durable power of attorney for healthcare document and the healthcare directive document require different kinds of witnesses. So just make sure you pay attention to that. Our document, which I put a link to in the chat, lists out those requirements. But if you're doing both, I highly recommend you think about getting a notary, because they can do both documents really easily. So how do you make sure those documents are followed? You want them to be clear. If there's a section that doesn't apply to you, cross it out or write not applicable so it's clear that you didn't accidentally just skip that section. I talked about knowing the different document requirements. Talk to your provider. Ask your provider specific questions. I know in the healthcare agents document, there's a section about CPR. If you want to know more about CPR and how it applies to you in your situation, ask her. And say, you know, I'm thinking about this. How would this play out in my life? And be patient with yourself and with others. I took this job and it took me over a year to actually write something down. Just know that even the professionals in this, it's hard on us too. So just give yourself some space and grace as you go through it. Now, the physician orders for life-sustaining treatment or PULSE. I want to just briefly touch upon this. It has to be done with medical providers. And it is specific medical orders for specific procedures. It was built for the seriously ill or medically frail at any age. Remember, the other two documents are for 18 and older. This is for any age. So you might have a teenager who is really medically frail, who has a pulse. And you might have a 70-year-old who's in great health who doesn't have one. And that's okay. It talks about specific procedures like CPR and ventilation, which is a breathing tube. I know we've heard a lot about ventilation with COVID. So what's important, the important difference when I talk about current health is that if an emergency responder sees this, they can do what it tells them to do because it is a medical order. It's like having a doctor tell them to do it. And this document will follow you. So if it were me and something happened to me in my home and I had a pulse and the EMTs did what the pulse said and then they took me to an ER, and this document will go into the ER with me. And then say I was in the ER for a little while and then I was up in a hospital room for a few months, then they might revert to the advanced directive. They probably would because that's a more long-term paper. But when and if I went to like a rehab facility, this document will follow me there too. So that's important to know that it follows you around, that it can be done what we call in the field. Now, mind you, it can be done in the field by professionals who are trained to look and understand it. So if you're walking down the street and a bystander sees something and helps you out, that's a different situation. So it has to be signed by the provider and by the patient or a legal representative. And that is my presentation. I want to let you know you can go to Places for Help. You can go to our website. That advanced directive, I shared the link in the chat, but it's up in the top right corner, and you can just click that. We also have a Find a Resource right next to it, and you can click that and put in your address and find someone who might be closer to you if you want. You can connect with us. You can contact us under Connect. Under Connect, we have a form you can fill out and send to us. We also have an email that's already been drafted in case you need a start for talking about it with your family and friends. Follow us. Our Twitter is really active, and we also have a Facebook page where we post different things that are going on specifically around this. And I will stop right there. I bet there are more questions. Beverly, do you have more questions for me? Because I'm at the question page.
Wonderful. Got a couple. So,
okay.
Would you go back to the hierarchy that you had for next of kin? We have some folks that are curious about what happens if you have no children or no spouse.
If you have no children or no spouse, then if your parents are still alive, they're going to look for your parents. If you have siblings, they're going to look for your siblings. It really goes down this chart that we have, and there is a link so you can print it in the chat box. If there is nobody, say they go through everything, then if there is a close friend who's willing to attest, and that's a legal thing, that they know your wishes, then they can make decisions. The best thing is to name someone so they don't have to go through that list. Now, there are people who don't have any of these, and so I often get the question, well, what should I do if I don't have any living relatives or any close friends? I'm basically throw in the woods. And I say, still fill out a document. Still fill out that durable power of attorney for healthcare document, so you don't have anyone's name. I think we have a box actually in our document. But still let people know what's important to you in case they name a guardian. And you can fill out the healthcare directive. There are places where you can hire someone if you have the financial means to be your healthcare advocate. WASHA, the Washington State Health Advocates Association, WASHAA, is a place where you can find people who do that for a living. So you could hire that. But I would say that do as much in documentation as you can and share it with your providers so that they have at least that reference.
Wonderful. Well, let's see. Would you mind just doing a quick review of the difference between the DPOA for healthcare and the PULSed form? Just a quick review.
Yeah, I can. Yeah, sure. So this is the healthcare agent form, and you have a lot more space to describe your values and goals, those outcomes that are really important to you. Remember, I talked about my dog and what's important to me. It's where you can name that healthcare agent. The PULSed is not where you're talking about outcomes. The pulse is really where you're talking about if an emergency person sees me and I am down in my house, this is what they need to do. The pulse can be, if there are certain things you do not want done and you know it, the pulse can be an avenue to make sure that that happens. So say you're a 70-year-old and you're healthy, but you know you don't want CPR. Talk to your physician about filling out a pulse that says that you do not want CPR and posting it in your house so that if someone calls, the emergency technicians can see it and then hopefully honor those wishes. Does that help?
I think that would help. So let's see. Oh, so that same person is curious that they've been told to consider doing a pulse, though they're not seriously ill or medically frail. What would be the value in doing that for a healthy person?
You know, I'm not gonna tell you what you should feel or what you should do or not do. But what I will say is that all of these documents are voluntary, every single one. There are some places, sometimes I know, where if you're living in an assisted living, they might make it a requirement about staying there. But from a legal and sort of practical application, and none of these are required documents. You know, if it's your provider saying this, you know, sometimes for a long time, PULSed was the form that people pulled out because they really didn't know how to talk about advanced directives. And so it may be a hangover. It may just be sort of just there. So ask questions why that person thinks it's important for you to do, you know, what the benefits for you specifically, and especially, even if you're like, I want everything done, you can still fill it out and say, I want everything done. But I don't want you to feel like you're pressured into doing it. Although there are some, like if it's a assisted living facility and that is one of their requirements, that's sort of between you and that facility. Does that make sense?
I think so.
Hopefully I helped.
Yeah. Well, so when folks are filling out this paperwork, if they fill out both documents for their advance directive, will notarizing be sufficient for both, or does one of them need two witnesses? Like, what needs to be notarized? What just needs witnesses? What's the story?
So if you're going to do both, I really recommend you get them notarized because you get it done all in one fell swoop. The same notary can do your healthcare agent form as can do your healthcare directive form. That's not true for witnesses. You have to have different witnesses. The PULSed is not notarized at all. It is signatures only, and it is signatures of Dr. A&RP, PA, and the patient or the legal representative of the patient.
Well,
I'm so excited that we can do notary.
I know. Yeah, so we actually have a couple people that are really curious about that. I don't think many people have heard about that before. Could you talk more about how that notary via Zoom or witness via Zoom works?
So it was something that it's really new, so don't worry about not knowing about it. It was like passed just recently and was supposed to go into effect in October. But because COVID hit, the governor kept putting a proclamation of allowing people to do it, and unless something radically changed, I'm sure every 30 days he's been saying it can be done. So the problem is that because it came so fast, a lot of people who are actually notaries, I'm one of them, I'm not set up to do it yet. I have been slowly building a list of notaries who can do it virtually. If that person would be kind enough to reach out to me so I can go back and just confirm, because some people said, yes, I'm doing this right now. I just want to confirm that they actually got, not only it's a special certification, but they also have proprietary video software stuff so that they can hold on to it for 10 years. So if you'll reach out to me, I know of at least one person for sure who is, and or if you want, there are a lot of notaries who will, meet you somewhere outside and you take turns, they'll watch you sign it. That's another way to do witnesses, is have them watch you through your window, sign the document and, and then sign it. So be creative, but also feel free to reach out to me and I'll help you problem solve.
Wonderful. We also have a couple notaries at People's Memorial, just saying.
Oh, you guys are so good. We're so well prepared.
Just a shameless plug. So when folks are completing these documents, let's see. Ooh, a couple good questions here. So let's say someone has created several versions of their durable power of attorney for healthcare and or healthcare directive, and they've distributed them to their doctors, their family, their friends. What if someone tries to contest it? If they say the version's not valid, or how do you resolve those conflicts?
So if there is a later document, that takes precedence.
Mm-hmm.
So, but it's also a great reminder and point that if you change your mind, which you could totally change your mind and redo your documents. It's not set in stone. To make sure that you redistribute. Your advance directive will only not be real unless there's another document that's later or unless you revoke it. So say you have an advance directive and you decide you don't want anything, you have to revoke it, you have to let people know. And I would honestly recommend is if you change your mind and you update it, just keep a list of everyone you're sharing it with and give it out again. Just, even if it's an email and say, my documents changed, the old document's no longer valid, my doctor has my new one or whatever. So just so people know.
So is there a set way to revoke those documents? Is it just like you can do it real informally, or do they have to submit some paperwork saying all the other versions are total crap now, ignore that?
Well, there is no set way except to say you have to revoke it. So what I would do, as long as you're giving people notice, and I would do it in writing, honestly. You could do it verbally and follow up in writing, but I would always do it in writing. So I know like a lot of places have that e-care stuff. You could just send a note to your doctor through e-care and say, I've revoked this. Here's my new document, and attach it. Or saying to family members through email or what have you. But it's an important point, but just know, as long as you want to make sure, if nobody else, that your healthcare agents, if you have that healthcare agent, that they have the most latest and greatest document. So at least splurge on copying it or sending them a virtual version. And by the way, the version that I linked to in the chat is a downloadable fillable, so you can type in. So, and then save it and then share it. So,
awesome.
That's a good question. Thank you. You guys are great at this.
Oh yeah, no, there's a couple good ones here still for you. So when someone does the whole project, gets all the paperwork done, finally finishes those documents, gets ready to meet with that attorney, and they're thinking they're going to create a will or just maybe a trust, will that attorney require them to redo those health documents with them?
So the Pulse document is done with medical. Advance directive, you shouldn't have to. Mm-hmm. And I would talk to your lawyer about why. I've worked with lawyers, and honestly, PMA works with a lot of great lawyers who understand that sometimes legalese does not help healthcare application. So, if you feel more confident and comfortable with having your lawyer also draw out something, then just make sure that the lawyer is modeling off of what you put in real language, so that that's consistent.
Wonderful. Ooh, it looks like a couple.
You guys are good at this.
I know, right? It looks like a couple people are wanting to go ahead and snag those links from you, both for the flow of next of kin as well as those downloadable documents. Would you drop those into the chat again? I'm trying to get on.
Yeah, I can. Let me drop them in again for you. I can also make sure I've shared the PDF of the PowerPoint, but I can also share a PDF of that hierarchy list. I know that's very helpful, and a PDF of our document itself. So I will do that too. Let me see if I can.
Oh, we'll make sure we also include them in the follow-up email for folks as well, just because we don't.
Yeah. And you can always go to our website and just, even if you're just emailing us through the contact form and say, I just need this and this, we'll send it to you. I'm going to stop sharing my screen so that I can access the chat box, and I will put those back in there for you because I know they're way up at top. So hang on some attendees. So I'm going to get that real quickly. Just bear with me. You know what? I can't pull that up right now for some reason, but I can copy and paste. I'm good at copying and pasting. So that is what I will do. So
it's all such valuable information. Let's see. What else do we have in here for questions?
Did that, there is a hierarchy.
Oh yeah, it looks like Amanda just volunteered a little bit of information. She was setting up her own documents, and when she met with her attorney, she just let them know that she had already completed that advanced directive for healthcare and done it on her own. And then they just made a line in their will that mentioned that, and they didn't have to use the attorney's version at all. So that sounds pretty reasonable.
Yeah.
All right. Is anybody else still
hopefully, yeah. Yeah, I'm getting those links right now, but you can find everything off of our website too. So just know that.
All right. Well, does anybody else have any questions they want to drop in here? Well, you can go ahead and add them into the chat box or use the question and answer feature, and we're happy to do what we can to demystify some of this for you. While people are typing, is there anything, in all the years that you've been doing this work, Bonnie, is there anything that people don't ask you and you wish that they would?
Oh, I think we've seen today that people are very good at asking questions.
Oh, well, what's something that you wish more people knew?
I said it earlier. I wish people knew that it can be a joyous, fun experience, that it doesn't have to be doom and gloom. And there are great ways to do it. There is a game called the Death Deck, which is just a bunch of cards. Yeah. And so you could play with it virtually. You could get everyone together and then you pick a card and everyone answers the question. And they have some really meaningful and poignant ones, and they have some really irreverent ones too. Yeah. So those are, and then we have a game called Foolproof that people can use too. But I just would like to it brings me so much joy to talk to people about this, because when I get to talk with people individually or in groups usually, I get to explore what is the most important about their life, what brings them happiness, what they love doing every single day, what brings meaning to their life. And I think if we think about it that way, it becomes a completely different conversation. That doesn't mean that there are scary things to talk about or sad things to consider. It's sad when I think about, we've even done an event directed for my dog. I mean, we've done events, and it's sad to think about my dog dying, but I know what's important to him. And so that'll help me make sure that in that moment, no matter how sad I am, I can make sure that I'm giving my dog what he would most want, I think. I mean, I'm not a dog psychic. So that's the biggest thing I want people to walk away with, is you can have fun. And I'm not saying you're not going to be sad, but you can also be joyous.
I like that perspective. I think we kind of struggle a little bit sometimes at PMA with that, trying to remind people that these can be productive conversations, and they might be challenging, but they're valuable and important. Oh, it looks
and
like
one more thing. I know. One more thing. I have found that when I do this with people and I help them do their documents, it's like they walk lighter afterwards. I can't explain. It's like they've done something that they've been wanting to do, and now it helps relieve something that they've been carrying as a burden. And the same is true with funeral planning too. I saw that with my parents when they finally planned their end of life funeral plans, and they were just like, "This makes me happy that I'm doing this for you." So, okay, what were you going to say?
Oh no, that's wonderful. That's such a great testament to what a gift it is to have these discussions. Oh, look at the happy baby.
Oh, I lost.
It looks like we lost Beverly. Sorry about that. Well, I think if I think if we don't have any other questions, we can end the presentation for the day. And for those of you who are still with us, we will be following up with an email, including the attachments that Bonnie has shared with us, Bonnie's email address, and there is a follow-up question that Bonnie wasn't able to answer for us in live time. So she's gonna do some research on her end, and I'll be able to include the answer there. And I'll also share that resource of WASHA for folks to find a durable power of attorney for healthcare if they don't have family or friends to do that for them. So with that, I think